What got me interested in medicine initially was actually an advisor back in college who kind of pushed me to think a little bit beyond the farm. I'm the first person in my family to go to medical school, and so that wasn't really on the radar. The kidneys do a lot more than most people realize, and that's true for medical students when they get into it too. And so early on you do some basic organ classes and you learn all the things the kidneys do: clean the blood, regulate electrolytes, manage acid. And there's a lot of math and science involved just in the day-to-day work there. And as a science nerd, a chemistry major, that really appealed to me. Nephrology turned out to really hit the high point for me of a combination of high acuity sick people in the hospital, so complicated medical problems, but then also it's one of those specialties where you spend a lot of time in clinic and really building relationships. Being able to do both of those things in one job was great. The most important part of patient relationship is trust and open communication. It's really important to me to take the time to listen to someone's concerns, complaints, and build that kind of back and forth rapport, and with that comes trust and then a good relationship. Hearing that you have kidney problems of any type can be a terrifying thing to hear, and it is important to know that many of our kidney problems are either treatable or slowable, and it's not a death sentence to have chronic kidney disease or a kidney injury or anything along those lines. I hope when people see me, they will come in expecting to be heard, that they'll have someone, me, take the time to listen to their concerns. I pride myself on explaining what's happening in terms they can understand. And I feel like my goal in any patient encounter is to have the patient leave it thinking, I know more than I did, and that visit went as well as it could have. This person cares about what happens.